Hello everyone, Rikta this side. Welcome back to Medicine Essence. Today we will be discussing one very important topic that you can see on screen. Here is small, tiny structure like appearance you can see on screen. That is something we called as microorganism. So, whenever this microorganism enters into the body and it started multiplying from single in number to start multiplying and making group or colony, and then it damage the body tissue. As a result, what happened? As a result, sign and symptoms will be showing. Persons may get sick. That will be calling as infections. So today our topic of discussions will be infections. From here we are starting the infection sessions, and we will be making ample of videos regarding these infections, and like in this way we will be covering these infections chapters. So this is the very basic steps from where we will be learning what is infections, what are those classifications of infections, terminologies regarding this. So by understanding those basic concepts, we will can further discuss about the disease process, how to manage those disease, because infections is the basic steps to know about the disease conditions and all. So what we see here, those tiny structures, okay, this is called microorganisms. So which all are coming under this microorganism. Microorganism, that is micro in nature, means very small in size. Even you can't see with your bare eyes. Whenever someone is sleeping, someone is eating, someone is going outside, there are ample of microorganisms floating around us, and we can't even see how many microorganisms entering into our body. Now you may confuse, if microorganisms entering in our body, then every time we will get the infections, right? But the thing is, we will call it as infection when microorganism enter in our bodies and it may damage our body tissue. I will explain further. So which all are coming under this microorganism? Viruses can be a microorganism, bacteria can be a microorganism, okay, parasite can be a microorganisms, fungi can be a microorganisms. Now you will ask me, ma'am, if there is ample of microorganisms floating around us and easily getting into our body, then why we are not getting infections? So the concept behind this is, there are microorganisms present inside or outside our bodies. They are floating actually, okay. So those microorganisms can be of two natures. One is good in nature, another one is bad in nature. So we love to be a good persons, right? So good microorganisms are good actually. They doesn't cause any disease. They does not have ability to cause the disease. That's why they are good in nature. As they are not causing disease, if they enter in our body, okay, enter to body, and if they multiply also, they doesn't cause any disease, okay. That's why microorganism entering in the body doesn't mean that it will cause the infection. Some microorganisms are good in nature. If they enter into our body, they will make normal flora inside our body that doesn't cause any disease. That's why they are good in nature, okay. Now some microorganisms, they are bad in nature. Now bad means it is the signs of or signs of negativity. That means they will damage to our body tissue. As a result, they will cause the disease. So they are having the ability to cause the disease. If they enter into our body, enter to body, they start multiply. As a result, they increase their number and they will be causing the disease. That's why they are bad in nature. So no matter whether microorganism entering in our body or not, no matter whether they are multiplying or not, they should damage the body tissue. If they damage the body tissue, they will cause the disease. Damage to body tissue, okay, body tissue, then they will cause the disease. If they doesn't damage the body tissue, they can't cause the disease. That's the concept, okay. So again, if I say what is infection, infections mean whenever any microorganism, either viruses or bacteria or parasite or fungi, they can be any microorganisms, if they enter into our body in a single amount, they start multiply themselves, okay. If they start multiply themselves and damage to the body tissue, as a result sign and symptoms will be occur, and that is called infections. So whether all microorganisms causing infection? No, because some microorganism good in nature, they doesn't cause any disease, that's why they are good in nature. And some microorganism, as soon as they enter into our body, they start multiply, they damage the surrounding body tissue and showing the sign and symptoms. As a result, they causes the disease, that's why they are bad in nature. Now, before understanding the further concept of infections, you must need to understand some terminologies regarding these infections. Okay, so what are those terminologies? Now we will be discussing one by one. Terminologies. Okay, now listen carefully. If I say microorganism, then you must be knowing the pathogen. What is pathogen? Sometimes I won't say microorganism. Sometimes I will say pathogen. Okay, now as I say this, some microorganisms are good in nature, some microorganisms are bad in nature. Now let's give them individual name. Okay, on the basis of disease occurrence, okay, the ability of causing the disease, we will give them a specific name. What are those names? Now pathogen. What is pathogen? Pathogen means if a microorganism, that can be viruses, bacteria, fungi, parasite, whatever it is, if a microorganism causes disease, okay, we will call them pathogen. So if a microorganisms, let's take an examples of this. If this microorganism, that means bad microorganism, if they causes disease, what we will call them? Simply we will call them pathogen. Okay, pathogen. Now if the bad microorganisms, another name is pathogen, what we will call this good microorganism? As this good microorganism, they doesn't cause any disease, so let's give them a name of non-pathogen. As simple as that, non-pathogen. So good microorganisms are non-pathogen as they doesn't cause disease. Bad microorganism, as they causes disease, we will call them pathogen. Now, so everything are based on that examples. Let's give an examples of Mycobacterium tuberculosis. Mycobacterium tuberculosis. Okay, what it causes? It causes TB. So do I call it pathogenic microorganism or pathogen or non-pathogen? Obviously we will call them pathogen. Why? Because they causes the disease. What is that disease name? The disease name is TB. That's why we will call it as pathogen. I hope it's clear to all. Now coming to the next concept. What is the concept? Concept is pathogenicity. The next terminology is that pathogenicity. Now what is this pathogenicity? You understood the pathogen. Now what is the pathogenicity? I will answer. The pathogenicity means ability of a microorganism to cause the disease. Now you don't understand what ma'am is saying, right? So simple meaning that can it cause disease or not? So your answer must be yes or no. Can this microorganism causes disease or not? If it is causes disease, then the microorganism is having pathogenicity. If the microorganism doesn't cause any disease, the microorganism is doesn't having any pathogenicity. Now give one example. Example of E. coli. I will give the example of E. coli, and I like this bacteria. I like this name. I like this bacteria. Now, if this E. coli is present in intestine, it doesn't cause any disease. It will be harmless when it is present in intestine. That time it will be having low pathogenicity, because in intestine genicity, okay, E. coli. But as soon as this E. coli will be reaching to UTI, urinary tract, urinary tract, okay, urinary tract, it will cause UTI. That time I will say it is having pathogenic site. Okay. So when this E. coli present intestine, it will act as a normal flora inside our body. It won't causes any harm. That's why it will be having low pathogenicity. As soon as it reach to the urinary tract, it causes urinary tract infections. Urinary tract infections, most common or microorganism is E. coli. And that time it will be showing its pathogenicity. So can you understood what is pathogenicity? Pathogen means if a microorganism causes disease. Pathogenicity means ability of a microorganism to cause the disease. Can the E. coli causes disease when it is present in intestine? Your answer will be no. That time it is not having any pathogenicity. Can E. coli causes disease when it is present in UT, urinary tract? Your answer will be yes. That time it causes urinary tract infection, and that time it will be having pathogenicity. Okay, I hope you clear with this concept. Now coming to the third terminology. What is the third terminology? Virulence. Virulence. Okay, what is virulence? Virulence means now you know that pathogenicity. E. coli जब यूरिनरी ट्रैक्ट में रहते हैं तब पैथोजेनिसिटी शो करते हैं, जब इंटेस्टाइन में रहते हैं तब पैथोजेनिसिटी शो नहीं करते हैं. नाउ डिग्री और strength of pathogenicity. ओके, कितना सीवियर अमाउंट में ये अपना पैथोजेनिसिटी शो करते हैं. ओके, और इन अनदर टर्म यू कैन से how severe the disease pathogen can cause. Now if I won't give an examples, you won't understand. Okay, how powerful or how dangerous the germ is. Simple meaning of this virulence. How dangerous or powerful the germ is. Now let's give an examples to make it clear. If I give you examples of simple rhinovirus that causes common cold. Understood? So common cold is like normal day-to-day infections. Like in my conditions, my personal view is that common cold in month, every time once or twice I am getting this common cold. So for me, within 2-3 days again it is automatically resolved. So for me, this rhinovirus which causing common cold having low virulence. Okay, it is not that much severe. But as soon as I take the examples of rabies virus, okay, then it is highly fatal, right? If a person is affected with this rabies virus, it is highly fatal. So do they have high virulent property? Yes, obviously, there is no doubt, high virulent. Okay, so इससे क्या पता चला कि कोई भी एक जर्म और माइक्रो ऑर्गेनिज्म दैट कैन बी वायरस, बैक्टीरिया, पैरासाइट्स, फंजाई. ओके, सो इफ आई टेक द एग्जांपल्स ऑफ वायरस, नाउ वन वायरस इज राइनोवायरस causing simple common cold, okay, runny noses, then mild fever, etc. That is low virulent. Because of common cold, people won't get died. Okay, but in case of rabies virus, if a person will affected with the rabies virus, it is highly fatal. Okay, once the person is affected with the rabies virus, he must die, right? So that's why it is highly virulent in nature. So that is the virulence, means the degree or strength of a pathogenicity, how much severe the disease or pathogen can cause. Okay, as I hope it's clear for you all. Now coming to the fourth terminology, pathogenesis. Now those terms are more or less sounds are same only. Pathogen, pathogenicity, pathogenesis. Now this pathogenesis means something which is in under process. So this is a process or steps. Okay, this is not a single step. Moreover, it is the summation of some steps by which disease develops. Understood? Disease develops. So disease develops after infection. So it is not a single step. Let's give an examples of micropathogens. Pathogen. Now pathogen taking entry to body. Okay, entry to body. Once it gets entered, it started multiplications. Okay, after multiplication it causes surrounding tissue damage. Okay, टिश्यू डैमेज होने का मतलब ही है सिम्टम्स शो करना, सिम्टम्स शो करेगा. As a result, infections will occur. Now, can you see? It is not a single step. It is a multiple step. Okay, through which microorganism enter the body, then multiply, showing sign and symptoms. As a result, infections occur. So there is a 5 steps or more steps depending on the pathogenicity of the microorganism. So this is a process or steps by which disease develops. So this is a process or steps. Now coming to the colonizations. Okay, colonizations. Fifth terminologies are colonization. Colonization. Okay. So what is colonization? Colonization means when microorganism or pathogens, microorganisms live and multiply. Okay. Multiply in or on the body without causing disease. Okay. जब कोई माइक्रो ऑर्गेनिज्म शरीर में प्रवेश करेगा, as soon as entering to the body, it won't showing its sign and symptoms. It will take some time. Okay. So this steps is peacefully. Okay. They stay peacefully. It won't cause any harm. So when a microorganisms or pathogen enter, okay, take entry, it will multiply. Okay. Multiply in numbers. Then till this much, no sign and symptoms. Then once it damage the body tissue, then it shows its sign and symptoms. Okay. So up to this much, until it makes the colony formations or getting multiple in number, then it won't show any sign and symptoms. Then it started damaging the body tissue and showing its sign and symptoms. That is called colonization. Colonization means microorganism शरीर में प्रवेश करेगा, then ये अपना नंबर बढ़ाएगा, it will stay for some times, it will multiply itself, increases its numbers. Till this time it won't show any sign and symptoms, and we will call it colonizations before it causing the infections or showing its sign and symptoms. Okay. Now coming to the sixth concept. Okay. What is the sixth concept? Sixth concept is that contaminations. What is contaminations? That is also related to terminologies of infections. So what is contaminations? When organisms are accidentally present on surface instruments or hands, we will call it that we got contaminated. Okay. So that's why sterilizations or maintaining the sterility is very important. Okay. Contaminations in syringe or surgical instrument, we need to discard or we need to sterilize them, otherwise it will cause contamination. Simply meaning of contamination is that whether the microorganism is present in that particular instrument or particular surface or particular people, persons, animal, whatever it is, that is called contamination. Now coming to the seventh concept of carrier. Okay. Carrier can be a person, not only a person, can be an animal also. Animal who harbors, okay, harbors or carries the pathogen, okay, pathogen, but does not showing any sign and symptoms, but can spread disease to others. That is called carrier. Okay. So if a person or animal can carries the pathogen but doesn't show any sign and symptoms, but by looking outside you can think that it is a healthy animal or healthy person, but the persons or animals is having the ability to spread the disease to others, those people or those persons or those animals are called carrier. Now the eighth concept is that reservoir simply meaning that residency or the place or the natural habitat. Okay. Natural habitat where microorganism lives and multiplies. Okay. It is the place where the microorganism can lives and multiplies. Okay. For human, if I give an examples of human can be a reservoir for typhoid Mary. Animal can be a reservoir for rabies. Okay. Soil can be a reservoir for tetanus, where those organisms can live and multiply. So this is called reservoir. Okay. Now coming to the next concept of host. Who all are called host? Host can be a person or animal. Okay. Or animal in which microorganism lives and causes disease. Okay, so that is the thing, a person's or animal in which microorganism lives and causes of the disease. So the next concept is that incubation period. Let's discuss about what is incubation period. Okay, incubation period means the time between entry of pathogen and appearance of first symptoms. Understood? So जब भी कोई पैथोजन शरीर में प्रवेश करेगा, then it won't show its sign and symptoms. It will take some time to show its first symptoms. That is called incubation periods. That this time duration is called incubation period. Now for COVID-19, if a COVID-19 or coronavirus enter into a body, it take at least 2 to 14 days to show its first sign and symptoms. That is COVID-19's incubation period. If I take an examples of hepatitis B, its incubation period is 1 to 6 months. So it will take at least 1 to 6 months to show its sign and symptoms. So the incubation period for hepatitis B is 1 to 6 month. So that's all about this terminologies related to infections. I will discuss again in a very simple way. So what is pathogen? Pathogen means any microorganism. कोई भी माइक्रो ऑर्गेनिज्म को हम लोग पैथोजन नहीं कह सकते हैं. ओनली दोज माइक्रो ऑर्गेनिज्म जो डिजीज कॉज करते हैं, बस उसी को ही हम लोग बोलेंगे पैथोजन. दोज माइक्रो ऑर्गेनिज्म व्हिच डजंट कॉज एनी डिजीज वी विल कॉल देम नॉन पैथोजन. नाउ इफ आई टेक एन एग्जांपल्स ऑफ माइक्रोबैक्टीरियम टीबी, वेदर इट इज पैथोजन और नॉन पैथोजन, ऑब्वियसली ये पैथोजन ही होगा क्योंकि ये टीबी कॉज करते हैं, ट्यूबरक्यूलोसिस. कमिंग टू द नेक्स्ट टर्म दैट इज पैथोजेनिसिटी. पैथोजेनिसिटी का सीधा बात है कि इफ कैन द पैथोजन कॉजेज डिजीज और नॉट. इफ इट इज कॉजेज द डिजीज we will say okay, this pathogen is having pathogenicity. If the microorganism can't cause any disease, then we will say it doesn't have any pathogenicity. If the pathogens or microorganism causing disease, we will call it that it is having pathogenicity. Now if a E. coli present inside the intestine, we will say it doesn't cause any disease, it is harmless at that time, so it is having low pathogenicity. Once it's reached to urinary tract, it shows urinary tract infection, then we will say that it is having pathogenic site. Okay, coming to the third concept of virulence. Virulence means if a microorganism, अगर वो microorganism और pathogenicity शो कर रहा है तो कितना स्ट्रेंथ में वो शो कर रहा है उसका पैथोजेनिसिटी और कितना सीवियर है उसका पैथोजेनिसिटी. एज सिंपल एज दैट. नाउ if I take examples of rhinovirus and rabies virus, rhinovirus सिंपली कॉमन कोल्ड कॉज करते हैं जो कि 2-3 दिन मैक्स टू मैक्स 1 वीक में रिजॉल्व हो जाते हैं. दैट मीन्स इसका लो विरुलेंस पावर है. बट इफ आई टेक एन एग्जांपल्स ऑफ रेबीज वायरस, वंस अ पर्सन इज अफेक्टेड विथ रेबीज वायरस, इट इज हाईली फैटल. इसके वजह से इंसान का डेथ भी होते हैं. दैट्स व्हाई इट इज हाई विरुलेंट इन नेचर. नाउ कमिंग टू द पैथोजेनेसिस. Pathogenesis means it is a process or multiple step. जब एक माइक्रो ऑर्गेनिज्म बॉडी में एंटर करेगा, एंटर करने के समय से लेके साइन एंड सिम्टम्स शो करने तक देयर आर मल्टीपल स्टेप्स थ्रू व्हिच इन्फेक्शंस ऑकर. दैट इज कॉल्ड पैथोजेनेसिस. लाइक अ पैथोजन आपके शरीर में एंटर करेगा, पहले वो मल्टीप्लाई करेगा, तब तक कोई साइन एंड सिम्टम्स शो नहीं करेगा. मल्टीप्लाई करने के बाद सराउंडिंग बॉडी टिश्यू डैमेज करके साइन एंड सिम्टम्स शो करेगा एंड इन्फेक्शन स्टार्ट हो जाएगा. सो दिस होल प्रोसेस इज कॉल्ड पैथोजेनेसिस. नाउ कमिंग टू द कोलोनाइजेशन. कोलोनाइजेशन का मोटा मोटा बात यह है कि माइक्रो ऑर्गेनिज्म लीव एंड मल्टीप्लाई इन और ऑन द बॉडी विदाउट कॉजिंग एनी डिजीज. सो जब तक ये मल्टीप्लाई करेगा तब तक ये पावर बना रहे हैं अपने अंदर ताकि वो डिजीज कॉज कर सके. सो ये मल्टीप्लाई करने तक कोई साइन एंड सिम्टम्स शो नहीं करेगा. Once it increases its number up to a threshold value, then it will damage the surrounding body tissue. As a result, signs and symptoms will be occurring. Then infection will get started. So it is called colonization. Okay. Now coming to the contamination. Contamination का मोटा मोटा बात ये है कि कोई भी surface या instrument या hands या anything that can be floor. Okay. सो कोई भी एक्सीडेंटली माइक्रो ऑर्गेनिज्म के साथ मिक्सअप हो जाए तो हम लोग कहलाएंगे उसको कंटामिनेटेड सरफेस, कंटामिनेटेड इंस्ट्रूमेंट. अगर एक इंस्ट्रूमेंट स्टेरिलाइज होके आया जब आप उसको ओपन सरफेस में रखोगे या फिर कोई भी इन्फेक्टेड पर्सन उसको टच कर देगा, दैट मीन्स वो इंस्ट्रूमेंट कंटामिनेटेड हो गया, सीधा बात। कमिंग टू द कैरियर, कैरियर मीन्स कोई भी पर्सन और एनिमल जो कि माइक्रो ऑर्गेनिज्म को कैरी करते हैं उनके बॉडी में, बट वो कोई भी साइन एंड सिम्टम शो नहीं करेगा। बाहर से आपको देख के लगेगा ये तो पूरा हेल्दी पर्सन है और हेल्दी एनिमल है, जबकि उसके पास एबिलिटी है वो डिजीज को स्प्रेड कर सके दूसरे पर्सन के पास। दोज पीपल और एनिमल आर कॉल्ड एज कैरियर। ओके, नाउ रिजर्वायर, रिजर्वायर मीन्स इट इज अ प्लेस और नेचुरल हैबिटेट जहां पे माइक्रो ऑर्गेनिज्म रहते हैं और मल्टीप्लाई करते हैं, ठीक है। सो रेबीज वायरस, जैसे कि रेबीज वायरस के लिए रिजर्वायर कौन है? एनिमल, आइदर कैन बी डॉग, कैट, bat, monkey, those are reservoir for rabies virus. If I take an examples of tetanus, where this tetanus virus stays, it stays in soil, it get multiply in soil itself. If I take an examples of typhoid, it presents in human body, it multiply there and it causes the disease once the infected person spread it to the other. Okay, that is called reservoir. This is a natural habitat, रहने का जगह है माइक्रो ऑर्गेनिज्म का और मल्टीप्लाई करने का। होस्ट किसको कहलाते हैं? अ पर्सन और एनिमल इन व्हिच माइक्रो ऑर्गेनिज्म लिव्स एंड कॉजेज द डिजीज। ससेप्टेबल होस्ट एक होता है, एक हेल्दी होस्ट होता है। हेल्दी होस्ट इतना साइन एंड सिम्टम शो नहीं करते हैं। ससेप्टेबल होस्ट बनने के लिए कुछ क्राइटेरिया फुलफिल होना चाहिए, जैसे कि उसको इम्यूनो कम्प्रोमाइज्ड होना चाहिए, जैसे कि उसको एल्डरली होने से वो ससेप्टेबल होस्ट बन जाते हैं, जैसे कि वो बच्चा होने से, बेबी होने से ससेप्टेबल होस्ट बन जाते हैं, एज बिकॉज बेबी का इम्यून सिस्टम इमेच्योर होते हैं। अगर कोई क्रोनिक स्मोकर है, कोई क्रोनिक अल्कोहल अब्यूज पर्सन है, कोई भी क्रोनिक डिजीज से सफर कर रहा है, HIV, एड्स, ऑल पीपल आर कमिंग अंडर ससेप्टेबल होस्ट बिकॉज दे कैन इजीली गेट द डिजीज, दैट्स व्हाई। इंक्यूबेशन पीरियड, इंक्यूबेशन पीरियड एक टाइम ड्यूरेशन होते हैं पैथोजन का एंट्री होने से शुरू करके साइन एंड सिम्टम शो होने तक, इस टाइम ड्यूरेशन को बोलते हैं इंक्यूबेशन पीरियड। हर इन्फेक्शन का इंक्यूबेशन पीरियड अलग अलग होते हैं, जैसे कि कोविड-19 के लिए आई गिव एन एग्जांपल्स ऑफ 2 to 14 days, हेपी के लिए 1 to 6 months, like that. So that's all about today's sessions where we have discussed regarding infections related to the important terminologies of this infection. So in next sessions we will be discussing regarding the main one of the important topic, that is classifications of various infections. So goodbye dear students, stay focused, stay motivated. Thank you.